All right. Welcome back to the Money Bear podcast. This is your host, Chloe Daniels. And today I have a guest who I'm really excited and have been excited for today. And I'm so glad we were able to record because we were both kind of ping ponging back and forth, being like, hey, can you push a half hour? And then we pushed it back half an hour. And then I got a weed whacker right outside of my door. And I was like, hey, we might need to push another 30 minutes. But luckily, guys, we made this happen. And I've got Jarod on. Jarod is the founder of a nonprofit organization called $4 that is focused on getting information out about the charity care section. Yes. But the way that I was even brought into or made aware of $4 is I had done a little bit of a rant about medical care and have done many rants about the medical system here in the United States. And I remember somebody had specifically tagged $4 and they're like, hey, you need to check out this company. They're doing some really cool work in the space. And then I found you and immediately DM'd you and was like, hey, you want to come on the podcast? I think this is a really important topic. So he was down and I'm super excited to have you on. So welcome to the podcast, Jarod.
Thank you so much. No, I really appreciate you reaching out and helping us spread the word. So I appreciate it.
Yeah. So tell us, what's your kind of elevator speech when you're explaining to people what $4 is and what you guys do?
That is a great question. So the elevator pitch, we eliminate medical debt by enforcing hospital charity care policies. If you don't know what that is, it is a federal law that was put into the Affordable Care Act. It requires nonprofit hospitals, which is most in America, to have these policies that help people within a certain income range. So if you are within a certain income range, hospitals are legally required to waive your medical bills. And the problem is that nobody knows about it and hospitals don't make it easy. So millions and millions of people declare bankruptcy or are on payment plans for bills they don't have to pay. And we are a patient advocate organization that helps people through that process. And we just hit $25 million of medical debt relief for people throughout the country. So
Heck yes, that's
that's,
gotta feel
I think
good.
that's the elevator.
Yeah, that's amazing. And you guys haven't been around for that long. When was $4 started?
That is a trick question. So I started something, it's been a journey. $4 as it exists now has been around for like 2 years, a little more than 2 years. $4 and all of the other things that we've been doing over the years started in 2015.
Okay. Okay, gotcha. So the actual entity as it is now has been about 2 years. And so the $25 million that you quoted, is that from the since 2015 or is that since the last 2 years?
That's just the last 2 years.
That's amazing. That's incredible. Congratulations.
Thank you. Thank you so much. It's been a wild couple years. Yeah, we've definitely made some changes and had to pivot over the years, and it's all been lovely. But the last 2 years it's really taken off.
That's really cool. So, what on earth inspired you to start $4? What was the thing that even before $4 was what it is today, and you were starting this back in 2015, doing essentially the mission work that you were doing? What was the catalyst for that?
Yeah, so in 2000, it's even older than that. So 2012, my wife and I were sitting at home. She got a phone call, and her aunt had passed away from cancer. And a few minutes later, I got a phone call. My cousin had gone into labor, 7 weeks premature. Baby needed a heart surgery to live. And it was like same day, same hour. Both of our families had these medical emergencies. And I just remember, a few family members talking about like, oh man, how are we going to pay for it? And how much is this going to cost? And what's that look like? And it's kind of my first like run in with the US healthcare system of just kind of being like, what? Like, why are we talking about this? And just that reality that so many people, when they are hit with a medical crisis, they have a financial crisis at the same time. And I wanted to be able to help people in that situation. So I started crowdfunding. Like I just started $1 for Portland. So I grew up in Portland in the Pacific Northwest, and I just started this like really grassroots, coffee shops, breweries, music venues, and people would sign up for these small reoccurring monthly donations. And every month we would pool the money together and pay medical bills for people in our community. So it was very like not a huge thing at all, but it was cool little Portland thing that we did for several years. So I did that from, 2012 is when I had the idea, officially launched in 2015. And then for years, we're just, paying medical bills. I met an attorney who's now on staff at Dollar Four, our general counsel, Eli. And he asked me at this event, he was like, "Hey, have you ever heard of charity care? I think that you could like leverage these policies to help more people." And I had never heard of it, but it kind of sounded too good to be true. He was like, "Oh, like you should be able to get a lot of these medical bills just to be eliminated or waived through these hospital programs." And I'm thinking like, okay, man,
It sounds way
whatever.
too good to be true, right?
So we started meeting up at this bar and just started like reading through hospital financial assistance and charity care policies. And it's like we're reading them and it exists. It's like in the policy, yeah, like if you make, in this income range, you're eligible for, 100% of your medical bills to be waived. And so we started filling out applications for people that we knew had medical debt. And in a few months, we got over $1 million of medical bills to disappear for people. It was just like, what the heck?
That's
Like,
crazy.
it was crazy. It was like, and also like I felt like a freaking chump because I had been paying
Yeah.
medical bills for all of these people in Portland that would have been eligible for free or reduced care if I would have known
Right.
about these programs. So it's a big eye opener for me. And from there, like a total shift of the organization. It's like, okay, I'm not raising, a dollar at a time here. I'm going to start advocating for patients to just enforce these policies because nobody knew about them.
Right. Oh my gosh, that's such a wild realization. I love that you were honest and that you're like, I kind of felt like a chump because it's like here I was doing what I think like I think so many of us are like, that's more than what most people would do. I mean, going out, starting these grassroots fundraising efforts essentially to help pay for community medical bills, that's incredible. But then to realize like this whole time, these could have just been paid without anybody having to, put money into it. And like essentially they should have been. So
Yeah.
it sounds like, and I know we're going to get into that or more deeper into it. It sounds like hospitals in general, even if they are a charity hospital or a nonprofit hospital, they are not upfront with this information. Why do you think that is? Is it because the hospitals themselves are not aware of this information, or is it just because they have no incentive to do that or to make patients aware?
It is like a great mix of things. I think that one, hospitals get billions of dollars in tax breaks for being nonprofits. So like 65% of hospitals in America are nonprofit and they get a tremendous amount of benefits for being nonprofit. And what they're supposed to do in exchange is provide community benefit. So they are telling the IRS, like, we will do these things for our community in exchange for this nonprofit status. And the main thing would be to provide charity care. And the law is written like hospitals need to have these policies, but it doesn't say like
You have
nothing
to.
about it is standardized. Nothing about it is like how generous do these policies need to be? Like who is eligible for these programs? And there's like some really vague information there. So I think hospitals have just kind of been able to double dip for a long time. They get all the benefits of being a nonprofit, and then they don't really have to offer the charity care that they say that they're going to, because it's like in their mind, they're like, well, the policy is on our website.
Yeah.
Like, and so all of the responsibility falls on the patient to find out about these programs and all that. And it's like, that's why nobody knows about it, because, people
Well,
go into the
and
hospital, there's the
yeah,
bills.
and exactly what you're saying earlier. It's like it's so messed up that in this country, the first thought of like, oh my gosh, my baby has to have open heart surgery is how am I going to pay for that? Like, how the heck
Yeah.
am I going to be able to afford this? Like, that shouldn't ever be a thought. But it's so interesting how I feel like it's so common. Our answer is it falls back on the patient, because even when thinking about like saying you do have insurance or say you are covered and you know that, it falls on you to make sure that the insurance company is like correct and up to date on their website, that they've got the providers listed. It's your responsibility to make sure you're picking the right hospital. And then when you pick the right hospital, you got to make sure that that doctor is also covered within that hospital or whatever, within that practice.
Mm-hmm.
And then if you're misbilled, it's your responsibility to take a look at the bill and make sure there aren't any mistakes. And it's your responsibility to go and advocate for it. It's like, that's like a full-time job. So it's just, this stuff enrages me to no end, which I'm sure you've probably had your own share of experiences with that. So what do people need to know about the Charity Care Act? Can you kind of break it down for us so that people who do qualify are aware of it and know to ask for this? Like, how do they go about it? What's the whole deal?
Okay, the whole deal. Let me let me think about it. So the first thing is that one, charity care exists. Hospital, charity care, hospital financial assistance, whatever they call it. And it exists outside of just nonprofit hospitals. A lot, in fact, most for-profit hospitals will also have policies like this. Now, most people just assume that they make too much money, that they don't qualify. A lot of people just think that, because they weren't eligible for food stamps or, some other type of benefit that, oh, because I wasn't eligible for that, I'm probably not eligible for this. Hospital charity care is one of the most generous when it comes to these benefits that you can get. Like, you can make quite a bit of money and still be eligible for these programs. So like, I'm in the Pacific Northwest. Every hospital in Oregon and Washington will waive 100% of your medical bills if you're at or below 300% of the federal poverty guidelines. And when you stack that up against a lot like Medicaid and food stamps and all that, it's quite generous. And a lot of them will have a sliding scale that will go up to, let's say, you get a full discount if you are at 300%, but then they have a sliding scale from 300 to 400%. And so, maybe you're not eligible for 100% of your bill to be waived, but maybe you're eligible for 75%. And just so people know, the federal poverty guideline is like 14,500 or something a year. So you can be a single person and be making, $47,000 or $43,000 a year and still be eligible for 100% of your bill to be waived at a lot of hospitals, which is not like, a lot of people just think, you got to be the poorest of the poor to be able to get these. And it's just not the case. You can be a family of four making up to $90,000 a year and still be eligible. So those are a few things. I always tell people, like, it takes 2 minutes to see if you're eligible. Like, check, see if you're eligible. It could save you a lot of time. So those would be a couple things.
So then when somebody is faced with a hospital bill, like at what point do they go in and check if they're eligible for charity care? Is it when you get a surprise bill? Is it when you're negotiating with the billing department? Is it when you're at the doctor's office and like making that appointment? Where does it make the most sense for folks to check what their eligibility is? And then once they find that out, how do they go about getting the benefits from it?
Yeah, so most people are going to apply for charity care once they receive a bill from the hospital. You can do it before that. Most people just don't. Mm-hmm. And that's fine. When you receive your bill in the mail, you have 240 days to apply for charity care. That is like the federal minimum. Sometimes hospitals will extend that, but you have 240 days. And think of charity care as like a status. You are awarded charity care status for a certain amount of time. Most of the time, hospitals will give you an award letter that says, like, you've been approved for 100% charity for the next 4 months or 6 months or whatever. And that little piece of paper is what you bring. If you need any type of care at that particular hospital, you will be covered at whatever amount you were approved for. And then after that expires, you would have to apply again and provide all the proof of income documents and do the whole process over again. So you don't have to have a medical bill to be approved for charity care.
You get it beforehand.
But most people.
Yeah, that's wild. That's not what I was expecting. It's like the golden ticket of like, here, I have this piece of paper that says that I can get medical care for free, essentially, at this location. That's incredible. And again, wild to me that so few people know that this exists. I think I told you when we talked prior to starting the podcast episode that my mom's been a nurse for a very long time. And when I told her about this, she's like, I didn't even know that was a thing. And I'm like, yeah, a lot of people have no idea this thing exists.
Yeah, it is the best kept secret of the Affordable Care Act. That is for sure. I mean, it's like hospitals have these programs and the responsibility is on the patient to find them and all that. And then the process of which like people need to apply. Most hospitals, like 90% of hospitals, require you to fax your applications into the hospital. Or it's like they put these obstacles and barriers to get these, and it's definitely on purpose. And so, yeah, a lot of people just either get super discouraged or they don't find out about it, or, they're like told that, oh yeah, just call that number on the back of your bill, in fine print, like if you need help with
Right.
your medical bill, call this number. But a lot of times that goes straight to billing, which then they like will try to put you on a payment plan. And so it's just a really like hospitals just do not do a great job of telling people about it. And so what we have done as an organization, we have created a screening tool. We collected the financial assistance policy data for every hospital in the country. So a patient can go to our website and put in their household size, their income, what hospital, and then it will tell them if we think they're eligible for charity care at their hospital. If they are eligible, then we have patient advocates that complete all the necessary paperwork, submit it to the hospital, and advocate on their behalf until hopefully the bills are either reduced or eliminated completely.
Amazing. And that's all at dollar4.org.
Dollar4.org. Yep. So all of our services are completely free. We don't charge. If patients want to do the full service route and have a patient advocate help them, that's totally fine. There's another option of self-advocacy. If you want to try to go at it by yourself, we have all the tips, tricks, and tools and some videos and educational material for people to kind of walk through that, and we can answer questions along the way. But we just want to make it accessible and easy and get it out there so people know about it. Because yeah, there are a lot of people that would be eligible for these programs. Like most estimates are around like 30 to 35% of Americans would be eligible for these programs. It's a lot of people.
That's so many people, and it's so many people too. So who might have otherwise done a payment plan, because it's my understanding, and you can correct me if I'm wrong, once you go into a payment plan agreement with a hospital, then you're no longer like eligible, or you're no longer eligible either for a discount, or is it also not eligible for the charity care?
So they probably want you to think that, but with charity care is if you've been on a payment plan with a hospital and then you find out that you're eligible for charity care, not only can we get the bill waived, but the hospital will legally required to refund you any payments that you've made. So we've actually
Amazing.
had patients, yeah, it's wild. Like we've gotten patients, thousands of dollars refunded, and then they get the medical bill waived. So like that's a big swing for a family or a single mom or whatever. Like you have all these people that, over the last 2 years, the hospital has been taking, $100 a month or whatever, trying to pay off this big bill. We just had a woman that she got like $4,500 check back from the hospital over, from payments over the last couple of years. And
That's so
it's
nice.
a big deal.
Oh, and you said so over the last couple of years. So then does that Charity Care Act, even though you have the 240 days to be able to apply, the back payments or the refund, it can go for a longer period of time?
Yeah. So in this particular case, like we fight for a handful of things that would be like hospitals would say, like, oh no, we don't do that.
Right.
But with this one, it's like if the hospital never told a patient about the program and they put them on a payment plan, like that hospital is wrongfully billing that patient. So we would fight like, no, it doesn't matter if it's within the 240 days. They should have never been on a payment plan anyways. And the only reason that they were on a payment plan is because you never told them what, another option. So it's like a predatory billing practice that happens all the time where people just are like, a lot of times people will even say like, oh, financial assistance. Like, what does that mean? Maybe that means, oh, it's a very generous, low, no interest payment plan. That's financial assistance. Where it's like, no,
there's also this option.
You should
over
check
here.
to see exactly. And it's a lot easier to sign up for a payment plan than it is to get approved for charity care. So it's also like, that of course that is like a seamless process, but
it takes 10 minutes probably. Yeah. Wild.
Yeah, you don't have to fax. You don't have to fax the info in for a payment plan. But so yeah, I mean, that is definitely not like the idea that, once you're on a payment plan, you're locked in and you can't do anything. Like,
that's good to know.
No way.
I'm glad I asked the question then, because I was like, I feel like that's a thing, but it's good to know that's something that can be fought against and in it as it should be. So, in dealing with the hospital systems and understanding the provisions in the act, I imagine that you've come across a lot of different situations of people being wrongfully billed or mistakes or things along those lines happening in bills. And I always like to add a couple of like actionable tips. Now, granted, $4 is an actionable tip in of itself. It's like go check to see if you qualify for the charity care provision within the Affordable Care Act. But in your experience, and I want to make it clear, $4 is not negotiating anybody's medical bills. They're not going out and advocating for people outside of the charity care portion of the Affordable Care Act. But in your own experience, have you seen common practices or have you seen easy things that people can do on their own to advocate for themselves when they're faced with a surprise medical bill or something that seems wildly out of what they were expecting?
Yeah, there's a handful of things that people should always, like, just good practice when it comes to, when you get that medical bill. One, see if you're eligible for charity care.
Mm-hmm.
Like, that's number one. Number two is you'll hear a lot of people say, ask for that itemized bill. That is, if you're not eligible for charity care and there's not any other resources that are out there for you, like, make sure that you're being charged the right amount. There's been a handful of articles come out where they estimate that like 80% of hospital bills have billing errors in them. That's a big number. Like, if you get a hospital,
80%. It's like you're significantly more likely to have a mistake than not have a mistake in your medical or in your
yeah,
invoice. That's crazy.
yeah. And it goes back to what we were talking about earlier, is like, and it's on you to
Yep.
find the errors, which is insane.
Insanity.
So
Ugh.
it's like, make sure that you were charged for the right thing. So get the itemized bill. And there are, I have a prop. Hang on a second.
Oh my gosh, I love it. For everybody who's watching on YouTube, we get a prop. Here it comes.
Sometimes your itemized bill comes in this form. Like, they don't make it easy. Like, they sending you a freaking CD,
Yeah.
and
I'm impressed you even
sometimes
have one of those in your desk.
I keep it for things like that because I just couldn't believe it. Like, you're asking for a receipt of something that you are being charged,
And
that
they sent you
they
a CD.
and they charged us for it. They charged us to get the receipt.
It's like
So
it's like they thought, how can I make this as inconvenient as it's like they should have just given you a VCR like, or a
yeah,
floppy
yeah,
disk.
so most hospitals won't do that, but I always find that funny. It's like,
It's so
oh my
petty.
gosh, I have to, yeah, very much so. So as for the itemized bill, there are a handful of websites. I think Healthcare Blue Book, or there's a couple others if you just Google like how to look through an itemized bill, and you can look up what are people being charged for these particular things. Like,
Mm-hmm.
the classic example that everybody always talks about is like the $80 Band-Aid. You look through your receipt and, bandage $80, and you're like, okay, I am being overcharged here. And you can then call and dispute these bills. So you would write like an appeal letter saying, hey, I think I was overcharged here, or I was charged for this, never happened, or I
Mm-hmm.
was double charged this. And you would, advocate for yourself to try and get that bill lowered. So that would be one thing. It's like, that's great practice just to make sure that you're getting billed for the right thing. If you are not eligible for charity care and your bill is correct and you just have a bill that is like too much, you can negotiate. They will tell you that you can't negotiate. You can. You always
Mm-hmm.
can. These numbers are, I've gotten in trouble for saying this because I've said this somewhere else where I said they're fake numbers. They're not fake in the sense that they don't exist. Like, the bill is real, but the number on that can be negotiated down. And I always tell people, like, if you can save a little bit of money, but you have 1 year. So I think just recently, most all the credit bureaus have adjusted it to where a medical bill, an unpaid medical bill, cannot impact your credit score until it's at the year mark. And it used
Mm-hmm.
to be 6 months. So now you have a full year, save some money, and get as much as you can to then go to that hospital and say, hey, I know that I have a $5,000 bill, but I've got $2,000 right here, and
Mm-hmm.
I can close this account right here, right now. Always ask for the settlement amount. They are always going to have a number where if they say, if you can pay this now, you can get a pretty big discount. And usually that is anywhere from 30 to 50% in my experience. I mean, they're better negotiators than I am for sure. I think I've gotten it down to like 70% on some bills where they want to close out the account
Right.
just as much as you do. Like they want to get paid. So if you can close it out, they'll take a lower number. And we have a whole bunch of scripts and, stuff that you can use when calling the hospital because it can be intimidating. Those would be a couple of things that I would tell people, like take a deep breath. You have time. You are not alone. This is not something that you should feel shame about. You did not choose to have a medical crisis, and then, get ready for a little bit of a battle because they
Yeah.
don't make it easy, unfortunately.
Unfortunately. And I love those tips because I think they're so important. So many people get afraid of like negotiating or think that they're doing something wrong. And it's like, no, you really should be doing it because healthcare should be a basic human right, like at the end of the day. And if you can find a way to lower your costs so that it's not a financial burden to you, because it should never be that way, like by all means, freaking do it. And one of the tips that I had heard as well, which I think is interesting, is now we've got Chat GPT. So I've heard of people being able to negotiate things using legalese language for their state, for the hospital, getting a script from ChatGPT. So it's like, definitely go and check out the scripts on Dollar4 as well. But I love that these tools are now also making it accessible to like come up with a script relatively quickly just to be able to negotiate that on the fly. So it's wild. Again, just falling back on the patient.
Yeah,
Oh,
the Chat GPT for sure. Like I have had some things be written for us using
yeah, I love
Chat
it.
GPT. And I think that another thing that people should realize is like it is definitely a marathon. I always tell people like call number one
Hmm.
is like we're not trying to get a deal. We're not trying to do anything. Like all we're trying to do is like it's like discovery phase. Call,
Yeah.
ask them what the
Collecting
settlement amount
information.
is. Yeah, like, and then if you don't like what you hear, hang up, call again tomorrow. Like, I will call and ask for a settlement amount, and they will tell me a number. And then I say, well, that doesn't work for me. I'll talk to you later. And hang up. I'll call back the next day, talk to a different person, ask for a settlement, get a completely different number. And I'll keep doing that for 5, 6 days until I get to a number that works or that, and every once
Wow.
in a while, it's just like you're talking to a nicer person that is willing to, take it down a little bit more. And the stakes aren't that high.
Right.
Like you can call again, you can call for the next 4 months and try and negotiate, like wear them down. I was just talking to a reporter today. Like a lot of times people are very overwhelmed with the reason that they have the medical bill. They had some type of emergency or whatnot. So if you are recovering from a surgery or you're going through chemo or you just don't have the bandwidth to fight this stuff, ask a family member, ask a friend, like
Mm-hmm.
lean on your community that can do this because sometimes the dynamic changes a little bit when you are doing it for someone else. You are a little bit more feisty. Like
Yeah.
you know what I mean, and that's great. Like, and there are people that are better than others, and if that like is a big, you know burden for you or stresses you out, like ask to see who can take that on, because a lot of times people ask like, oh, how can I help, whatever. Rarely do people actually say like, can you just wait on hold with this hospital for me? Like that would be a big deal.
Yeah, I love that tip because I think it's something that's it's such a low lift in terms of of asking something for somebody, but it is a huge impact in terms of like the stress
Mhm.
relief, somebody who maybe has a lot of anxiety around those things. It's like hiring a mom for a moment just to be like, hey, will you like
Yeah.
essentially be an advocate for me? I'm going through this stuff right now and I need help. And I think a lot of us are really bad at asking for help. And that's like a way that somebody can help in a big way that doesn't cost them anything but time. So, plus,
Mhm.
when you're fighting somebody else's battle, sometimes it's really satisfying, really fun. So,
Yeah.
I think these are such good tips. Also, when you were saying like the numbers are fake, it's like, I get that somebody's like, they're not fake numbers, but they kind of are. I mean, if we're talking about the settlement number changing on a daily basis, you can't say that's a
Yeah.
real number. And on top of it, it's like, there's been known incidences, and it's pretty common, where somebody who will go in with insurance will get a very different price than somebody who goes in who doesn't have insurance. So it's like these numbers they're not like cut and dry, and they're changing all the time, which is just maddening. I have one other question for you in relation to this particular topic, and then I have like two fun questions that we ask everybody. But I know you're pretty
Okay.
big on TikTok. I know you've been creating reels and TikToks and things along those lines. Have you ever seen a piece of advice around negotiating medical debt that you're like, ooh, that's bad advice? That's something I would not do and would not recommend.
Yes, many. So there is a trend right now that I see a lot where people say that you can just ignore the bill, let it go to collections, and then you can ask the collections agency to verify the debt.
Mm-hmm.
And that, what they claim is the collection agency won't be able to verify the debt because it would be a HIPAA violation for them to have your medical records or the reason why you have the bill. And then the bill just goes away. And like I see these videos, they have millions of views, and it's like, here's a sample letter and here's what you can do. I stitched one of them recently and just was like, hey, like this is just not how it works. You like
Yeah.
Now I am sure that has worked for someone.
Yes.
Like,
Yes. Well, because
but
debt
that is,
collectors, just like we were talking about with hospitals, debt collectors are also very ill-equipped to do their jobs. Like debt collectors, like the turnover rate for a debt collector is like 45 days is the average. So it's like you get new and new people.
oh
So
my
I am
gosh.
sure that's happened. I have no doubt that's happened, but it's probably not because that's what you do.
Yeah. And encouraging people to let their bills just go to collections and all that is bad advice, especially when you are up against a 240-day deadline for charity care. Like
Yeah.
getting your medical bills to a certain point to try and try this kind of like very rare solution might take you out of the running for a lot of other resources that actually work. And the other
Right.
thing is there's a whole bunch of other reasons why that's just like they can verify the debt.
Right.
Like a lot of times when you go to the hospital, you sign something that says like, yeah, you can try and collect from me, and the hospitals will hire collection agencies to do that. It's not like illegal weird thing that people are like getting sent to collections. So anyways, that's one.
That's
I'm sure
wild.
there's a handful of other ones, but I've seen that one just happen a lot. Another thing that people think is that just the act of asking for an itemized bill will
Mm-hmm.
result in a lower bill.
Mm.
And that does happen. It can happen because sometimes the billing department is looking at it and they're like, oh, we charge this person $100 for a Band-Aid. We should probably take that out. And sometimes it can come back lower just by asking for it. But again, there's no magic bullet here.
Yeah, there's no hack.
It is, yeah, like charity care exists, and it is one thing that is like you can take it to the bank in the fact that if you are within the income guidelines and you're within the timing of the 240 days, like you can usually get a discount or whatnot. But everything else is going to be like every hospital is different. Every state has different. I mean,
Yeah.
there are states that have made their own charity care laws outside of the federal laws. And it's just like there's just so much nuance to all of this that
Yeah.
I don't like when people make videos that are so general. Like, if you do this, you get, a discount. It's like, well,
Yeah.
sometimes maybe.
Yeah,
So
right. No, it's wild to me. I mean, obviously being in the money space, we see a lot of bad stuff out there too, and in terms of what people can and can't do. And it blows my mind when people are telling people to not pay their debt, because it's like you do realize that's still going to impact your credit score. It's bad advice just in general. And then I always wonder about the creator itself. It's like, how are you not getting sued by this? Like, how is this not happening when they take a huge hit to their credit score, depending on the debt? But it's a wild
it's
world. There's the
very,
beauty of social media is being able to get the good information out there, but then there's that like dark side of it as well.
yeah, it's definitely what gets views, what gets clicks, and
Yep.
the clickbaity bullshit like stuff that you see is normally just that. It's people trying to get views, and they saw some other creator,
Yep.
make a video that got a bunch of views, and they rip it out. Like I can't tell you how many videos. Like we had what started us in this like crazy growth of the last 2 years was a TikTok video. Like
Yeah.
I made a TikTok video that told people about charity care because nobody knew about it and I couldn't get anybody to talk about it. So I hopped on TikTok and made a video telling people about charity care. and it blew up. And I have
Hmm.
seen dozens of creators take like my exact words, like
Hmm.
not even no change at all, just like same info, same words, and say they even will take my screenshots like from my video and use it in theirs.
That's
And like
so lazy. Ugh.
it's just one of the, but the thing is though,
The information's getting out
is it
there.
still gets views, like
Yeah.
people, because it's good information. It's
Yeah.
actually like people are desperate for this type of information. It is such relevant information, and there are
Yep.
so many people that are going through it. Like every time I speak, it's like, how many of you all have medical bills or know someone that has medical bills? There's not a single person that doesn't
Yeah.
know someone that could use that info. So it always gets views, which is like, yeah, whatever. I'm happy the info is getting out there, but it's just funny when you see. So,
The exact
anyways,
same thing. Yeah. No, it definitely, it happens. It happens all the time. And that's the thing. We as creators just have to remind ourselves, it's like, well, the information's getting out there. And if it's good information, like we want it to get out there. But yeah, it's like have a little bit of creativity or save the time and energy and just stitch your video. Just do it, you know?
the only thing that makes me actually mad is I'm like, at least tag me,
Yes.
because the
Because you
thing
have the
is,
information.
exactly, I'm like, because what happens is it does get a lot of views and then it gets a lot of comments and people ask that creator questions that
They don't
actually
have
freaking
answers.
know the answer. So I'm
Yep.
like, at least direct them to a resource that works. Like
Well,
that's
you've
a
just
different
you've just
conversation.
given me an idea. I'm so excited, and this whole time that we've been chatting, I'm just like, I just want so many people to listen to this. I want so many people to see this because this is so important. I'm gonna take that TikTok and I'm gonna duet it and I'm gonna put it on Instagram and TikTok as well. But I'll duet it and I'll be like, I don't have the information. Jarod here does. And by the way, go listen to the Money Bear podcast. Wins
I
all
appreciate it.
around. Awesome. Well, this was a really fantastic conversation. I'm so glad we were able to get you on today. And I appreciate you taking the time to do it. We're going to do our best to continue spreading the word about $4. And we're adding everybody who has not yet downloaded the money guide. We are adding this information to the money guide as well, because I think that this is such an important thing for us to be spreading the word about, that I want to get that information into as many people's hands as possible. So thank you again for the work that you're doing.
Thank you.
Absolutely. I've got two fun questions for you that are completely unrelated to all of this. Are you prepared?
I hope so.
Okay. Well, first, before we get to the fun questions, tell everybody, where can they find you? Where can they get this information? Let's just repeat it all in case they missed it.
Yes. So if you have medical bills or know someone that has medical bills, you can go to dollar4.org/help. That will go directly to our screener. You can go to dollar4.org and check out information there. But if you want to see if you're eligible, dollar4.org/help. And then you can fill out the information and someone will get in contact with you.
Awesome. And you can also find him on Instagram and TikTok. And just for those who are listening, FOR is FOR. So we'll leave links to that down in the show notes. All right, Jarod, what is your very first money memory?
Money memory. When I was a little kid, my uncle, I was probably being super annoying, and he wanted to like, I don't know if this qualifies as a money memory, but
Sure.
he wanted to keep me occupied because I was running around like a crazy little kid. So he gave me like a 2x4, like a piece of wood and a bunch of nails. And he said, for every nail that I can hammer into the thing like straight, he would give me a penny.
Oh
So
my
I sat there for hours, and I think at the end I had like 100 nails. He gave me I had 98 nails, and he rounded up very generously and gave me $1.
Oh my gosh, what? That's so funny. I bet you're really good
The
at nailing things now, I guess, using a
Absolutely
hammer.
not. That is so funny. Yeah, Uncle Jack just
Shout out.
giving me the, I don't know, does that count? Does that count as a money
Yeah, of
memory?
course. No, everybody's money memory is different. And sometimes it's like a really traumatic memory. So I've added this next second question so that we can end on a fun note. But it's like, I feel like 50-50. It's like it's more funny rather than traumatic. So that one definitely falls into the funny category. Do you think that taught you anything about money?
No, I
I was
don't.
like,
I
probably
mean,
not.
well, probably like, well, it's funny because it's like when I think about that, I think that was probably like the first like money exchange, like somebody
Mhm.
like, you do this and I will give you this kind of thing. And I was pumped. I was just pumped to have $1. Like I don't even know. I was probably like 4.
I mean, 90
So
plus nails is very impressive. Like that you
No,
did correctly. That you did correctly. That's so many.
it's that's super funny.
Yeah.
I don't know where that came from, but
Now
that's my first money memory.
you'll have to ask your wife what her first money memory is and compare stories to how it impacted her or how it didn't.
I know. I mean, how many people? It's like the tooth fairy. Like that's the
Yeah.
first money memory,
Well,
right?
actually, no, that in all the people that I've interviewed, I've never had that be the first money memory. The most common first money memory that I've had, and it's so funny because it's all my entrepreneur friends, they have the memory of when they were a kid, they would buy candy at like a grocery store or whatever in bulk, and then they would sell it. And I was like, oh my God,
Oh,
we have all these little like candy drug dealers who are like upselling their friends. And it was just funny. I think like my first 3 or 4 episodes, that was everybody's first money memory. And I was like, this is interesting.
that is funny. That is not me. I mean, I had several lemonade stands, but not. I was not the candy like hustler.
Yeah.
Not that person.
All
That's
right.
funny.
And then my other fun question is there anything that you're just like obsessed with right now? Whether binge watching a television series, binge listening to a podcast, reading a new series, what's currently the new fun thing in your life right now?
Okay, two quick things. One, Succession. I love
Okay.
Succession. I've been
Yeah.
watching Succession, so that is definitely the show that I'm watching. And then my wife and I bought a old 1928 house that is a fixer and has been a fixer for the last 2 years. It was vacant for 3 years and it
Oh,
was
wow.
previously owned by a hoarder. So the house is an absolute shit show. It has been an absolute shit show. And we have been fixing it up. So we are doing a lot of yard work right now and just, yeah, doing a lot of housework.
I
So that
love
has
that.
been everything outside of Dollar Four has been doing stuff on the old crappy house, trying to make it
That will
trying to make it nice.
someday be your adorable, very customized house to you and your family. I love that. Awesome. Well, thanks again, Jarod. This was a really fantastic conversation and cathartic in a way as well, just because of the inner rage that I have at the system. So it's nice to know that there is a way to help a good portion of the people out there who are facing this. And we're excited to put it out there. So thank you again for everything you're doing.
Thank you so much for having me. Appreciate it.
Thank you so much for listening to the Money Bear podcast. If you've made it this far, do us a favor, take 2 seconds, rate, review, and subscribe. It seriously means the world to me. And if you just take a sec to do that, I will appreciate you endlessly. And if you do, let me know on Instagram and I'll thank you personally. So, got that. And of course, since we were talking about anything financial on this show, please note that nothing on this show is intended as financial advice. I don't know you, unfortunately. And because of that, I cannot tell you what to do with your money. You got to work with a financial professional who knows your situation, who is preferably a fiduciary. And keep in mind that everything that we talk about on this podcast is for education and entertainment purposes only. It's all my opinion. So, there's that. If you want to see our full terms and conditions, head on over to the show notes. And while you're there, we've got free resources for you to get started on your money journey down in the show notes as well, including a free guide to help you with your budgeting templates and budgeting tutorials and investing 101, understanding the different accounts that are out there. All that good stuff is inside of my free guide, which is also available at thelazyinvestorscourse.com/guide. And if you're ready to take our relationship to the next level, also, I've got a free investing class that is available at thelazyinvestorscourse.com/webinar. We host it once a month. If you're ready to take our relationship to the next level, I am also hosting a monthly investing class. And that investing class, you can find the times we're offering it this month at thelazyinvestorscourse.com/webinar. That link is in the show notes as well. And that's where you have the chance to meet me live and ask those money questions live. It's a good time. We've had over 20,000 people as of recording this join or register. And yeah, it's always nice to meet you guys. So I hope to see you there. Again, all that is available down in the show notes. So thank you again for coming and listening. I appreciate you, and I'll see you next week.